Hi, my name is Catherine Nguyen, and I'm a student physical therapy assistant from CBD College. And today we'll be talking about the effects of exercise, physical activity on the cardiovascular system, and how lifetime fitness is appropriate for people in the senior citizen age category. Okay, sorry. For the first question, we'll define physical activity, fitness, and endurance. So, physical activity can be anything you do in your house, anything you do as a day to day task, like buying groceries, going for a walk, walking your dog. It can be cleaning the house, be sweeping. Any of those things are considered physical activity. Grabbing the mail, all things like that. Fitness is your ability to perform physical activities and how well your body responds to certain exercises. So that could be strength, stability, flexibility, and all kinds of ways your body reacts to all of those physical exercises. And endurance is how long you're able to sustain exercise or physical activity. So how long you can run for, how long you can stand for without falling over, how long you can squat for, how many stairs you can go up and down without losing your breath, or things like that. So the second question is the benefits on aerobic training on heart rate, blood pressure, stroke volume, and cardiac output. For heart rate, the more aerobic exercise you do, the lower your resting heart rate is. So I've actually been trying it for myself. I've increased my running over the 2 years, and I've noticed some drastic measurements and changes from me in college when I wasn't as physical. My resting heart rate was lower, and it is lower now. It's more in the 60s. It used to be in the 80s. I was extremely sedentary. I was kind of higher in weight. So it was, my heart had to work a lot harder to pump the blood versus now that it's so used to me working so hard from time to time, it's like, oh, it only takes this much pumping to move the blood in and out. Aerobic exercise also helps with blood pressure by reducing the risk of heart disease and stroke. So you have decreased blood pressure, which means your body isn't struggling to push, and your veins and arteries aren't maybe filled with buildup or having any issues. So that it just makes sure that your heart is being exercised. A muscle needs to be exercised, and your heart is an example of a muscle. Stroke volume. Aerobic exercise improves stroke volume by making sure it's using the most efficient path or efficient way to pump the blood. Your body will always take the path of least resistance, and training it to work in difficult situations and pump and exercise and move out of its regular range will make at rest much easier for your body to maintain. And so that is the good thing about aerobic exercise and stroke volume. And when it comes to cardiac output, it just enhances exercise overall, makes it easier and better for your body when it wants to circulate oxygen through. So when you exercise, you might have to respire more, and more oxygen exchange will be happening through the blood. And the more you exercise, it will improve the circulation and delivery of that oxygen through your body at rest, while you're sleeping, etc., etc. Harmful effects of sitting too much. So, as I said prior to, being really sedentary increased my resting heart rate. So my heart was working a lot harder while I was relaxing, while I was studying. And so I had a lot more problems with blood and blood flow and knee pain and swelling and such. So that was my issue. But some people will struggle with muscle weakness, particularly in your legs, because you're sitting so far back. The blood doesn't flow all the way to the bottom of your leg. You're not having full movement. So then your feet start to build up and swell up, and it becomes a lot of pain when you start to put pressure on your feet because it's just not used to feeling the weight of your body all the time. Also, being sedentary can increase obesity, which will cause more pressure on the joints and just like more pressure on your back. It kind of puts you into a pelvic anterior tilt position, because you've got so much adipose on the front side. So your body, again, like I said, wants to take least resistance. So it's just going to like lean forward instead of holding your core tight, having that spine straight. It's going to relax. And it can also increase heart disease, lack of aerobic exercise, being sedentary. So your heart isn't working out as much. You're going to lose its strength. It's going to lose its size. It's just going to get weaker, and it's going to take a lot more work versus like something that's been trained regularly, something that's working hard and regularly being put under exercise. It's going to make things while you're relaxed a lot easier. So necessary precautions before we start an exercise program for the older population is to make sure that they have talked to their doctor and that they've gone through the proper blood work and they know that their heart, everything else is in the proper condition to continue with exercise. Once you've been approved with that, make sure that they have good balance, they are visually, like what their impairments are and understand what they're capable and not capable of doing. Find a base level, start very slow, making sure that they are comfortable with what they're doing, comfortable with themselves, and they trust you, because a lot of people won't perform at their best when they trust who's training them or trust themselves to like hold the weight or go down to the full squat, or if they're afraid to even let the arm out of like a surgical movement. Just making sure that trust is there with you and your patient and they feel confident in what you're teaching them. That's super important. Making sure you're actually doing exercises that help what they're doing. If you're using mindless exercises for someone, shoulder exercises for someone who struggles with gait, balance, or anything like that, it's useless. So making sure that your plan of care and the exercises that you choose are intentional, with the patient's best interest at hand, and also following that plan of care. And if they come in one day and they're like, hey, like whatever we did last week was a little too much, too sore, or it just made my heart feel too much, maybe consult a doctor. No, consult a doctor, report that to your physical therapist, and then decrease the exercise load to make sure that their output doesn't feel so aggressive until they're comfortable and ready to continue progressing again. Some patients will be a little more difficult with the progression and maybe say it's too hard. You will be able to gauge by taking their vitals, seeing if they're respiring really difficultly, panting, being able to tell if actually this is too difficult or not. That is the decision we are required to make. I hope this answers all the questions.